There is general concern about whether or not there will be liberalization of imports of U.S. pork containing clenbuterol. The Legislative Yuan Social Welfare and Environmental Hygiene Committee made a report on U.S. pork containing clenbuterol. Legislators demanded that the Ministry of Health and Welfare immediately mobilize and make a study of the risks of these additives on human health.
There is general concern about whether or not there will be liberalization of imports of U.S. pork containing ractopamine and clenbuterol. Legislators found that elementary school children's school lunches contain a high proportion of pork. If the government opens imports to an inflow of U.S. pork with these additives, this will adversely impact children's food safety. Some legislators also pointed out that after Taiwan opened to imports of U.S. beef with clenbuterol in 2012, the Ministry of Health and Welfare, Food and Drug Administration, sampled and tested 16,000 batches of U.S. beef imports, and only 7 batches failed. However, according to the latest research from the National Health Research Institutes on Taiwanese people's urine specimens, this showed that ractopamine and 7 other kinds of clenbuterol were detected in a small proportion. It is thus suspected that these results were from unfavorable FDA customs checks. Regardless of whether the U.S. pork imports are liberalized in the future, legislators demanded that the Ministry of Health and Welfare should start immediately on a health risk assessment report. The MOHW emphasized that, at this stage, ractopamine management applies differently to both beef and pork, but excludes offal.